interest of time, we're going to get started. Can everybody hear me on this mic too? Okay, great. So for those of you that don't know me, my name is Carissa Rolon, and I work for United Way. I'm the Director of Healthy Aging and Government Relations. And my co-presenter here, I'll let her introduce herself.
Hi, I'm Amy Angelo, and I'm an employee of Catholic Charities, and we're working with the United Way for this partnership of the Gatekeeper program.
So thanks everybody for coming today. I thought I would start by telling you a little bit of a story, and those of you that work in the nonprofit field, you've probably had something similar happen. A number of years ago, I switched over and started working in the nonprofit field, and I went to a meeting that was called by one of the local cities that shall not be named. And we sat through, the meeting started around 6, it went until 9 o'clock. And so the whole first meeting, we had a very long discussion about what our committee should be called. And we brainstormed a list, and they made a big point of telling us what brainstorming is and that you don't want to shoot down anybody's ideas. So the whole first 3 hours, the whole first meeting was brainstorming. And then the second meeting, we started analyzing and digging into what the committee should be called. And after the 6th month of still trying to decide what the committee should be called and not actually doing any work, I stopped going to the meetings because I thought this is kind of a waste of my time. So what I'm hoping for you today is that this is not a waste of your time. So I'd like, a lot of times we go to conferences, and I know that I go to one annual conference every year, and yes, we are located, United Way of the Greater Lehigh Valley serves both Lehigh County and Northampton County. So we're kind of that territory. So every year I go to this conference called Great Makers in Aging. I'm going again next week, and just a couple days ago, I found my folder from last year. And I attended for 4 days, wrote all these notes, intended to come back and email everyone and tell them. And I found the folder in my bedroom because I forgot to ever take it back to work. So I know that happens so often that we go to conferences like this and we're sitting there thinking, oh wow, this is really great, and I could do this when I get back, and I could do this, and I'll connect it with this person. And then we never do anything, and nothing ever changes. So what we're offering you today is the chance to change the world, but only the Lehigh Valley, small part. So we're going to tell you 4 things that you can do today to change the Lehigh Valley. And yes, the United Way, or we encompass both Lehigh and Northampton County. Okay, so the Gatekeeper program is a collective community approach to connecting seniors in need to appropriate services. And gatekeepers are trained to identify the warning signs that a senior may be in need of help and to call a gatekeeper referral number and report their concerns. So that was very simple, I just read the slide. But the bigger issue is, if you were here this morning, you heard a lot of the speakers saying, how do we reach out to the community? How do we actually find seniors who are in trouble? And how do we get them connected to services? So some of you here might actually be caregivers of somebody who has Alzheimer's. Can I get a show of hands of how many people are actually caregiving for somebody with Alzheimer's? Okay. So, but one thing that we hear from caregivers is that a lot of times they feel alone, that they feel like no one else knows what they're going through, that they're suffering. I recently went to a class at Northampton Community College, and it was on empowering your life or something. And as we went around the room, there were 20 or so women, and my boyfriend, because I made him go, he was the only guy. And as we went around the room, they asked why people had gone to the conference. And the first lady said, well, my mother has Alzheimer's, and I'm her primary caregiver, and I just wanted to get out of the house and do something for myself. And the second person, well, my son has a disability, and I'm his primary caregiver, and I just wanted to get out of the house and do something for myself. And by the time we made it around the room, out of the 20 people that were there, about 15 of them were caregivers. And it was a great class, but there's also kind of an extension beyond just reaching out for a single class. And we're really concerned with how do we find these caregivers who are having difficulty, who are struggling, and let them know that they're not alone, that there are services available that can give them some respite, that can give them some help. And sometimes those services are free, and sometimes those services are paid for by United Way, and sometimes they can be paid for by government benefits. So you don't have to feel alone, you don't have to struggle through it. And also, another important population is the population of seniors that don't have a caregiver. For the first time, we're really seeing baby boomers becoming old. And the different thing about baby boomers is that a lot of them are divorced, and a lot of them don't have a spouse, they don't have a caregiver, a lot of them don't have children, or they don't have children who live in the area. So you have a lot more people who are developing symptoms of Alzheimer's without having that social structure that usually recognizes when they're starting to show signs of dementia. And so how do we find those people and connect them? So I just want to get, we are kind of doing a weird presentation today because we often do it to two different types of groups. One group who we often train about Gatekeeper is more informational. So these would be social workers, people who work in hospitals who might be traditional social workers, people who work for nonprofits, Meals on Wheels. And those are the traditional caregivers, the informed traditional referral sources. And then we educate a whole variety of other people, people from the community, people who work, let's say, for a for-profit like UGI or PPNL. So I just wanted to get a show of hands. How many people believe that as part of their job, they are a traditional referral source? Okay. So you people will not leave here today being trained gatekeepers. And how many people, the rest of you I would assume, are not, in which case please make sure that you get a gatekeeper card before you leave. So do you want to hand them out? Sure. Okay, so Amy's going to run around and pass a bunch of those out. For the rest of you though, I think it's really important for people who are already traditional referral sources to understand that this is working in the community so that you're not duplicating services and not spending money that you don't need to spend. So the Gatekeeper program is a collective community approach to connecting seniors in need. And I believe I said this before. That's what happens when you hold the remote upside down. Okay, so here's a list of people who are genuinely gatekeepers. Apartment and living community managers, people who might be mail carriers. We plan on training everybody from the Postal Service, farm equipment dealers, grocery store personnel, home delivery, fuel distributors, utility companies. You can read through the list. So far, we have trained the majority of the employees at UGI, who were very excited to get the program. We've been training mayor's offices. We've been training the fire companies, which are kind of pseudo already referring, but we've been training, we're really looking for gas dealerships, like places where people get their gas, grocery store owners, liquor store owners. So these are the people that will come into contact with seniors who are having a problem, who might not ever go to a senior fair, might not ever go to a social worker. And so they're not being seen by traditional referral sources, but they're out there in the community. Does anybody here know what the word NEBBY means? Anybody? NEBBY? N-E-B-B-Y? Nobody. Okay. We have a bunch of Eastern PA people here. I grew up in Western PA, and there's a word that everyone in Western PA knows. It's called NEBBY. And NEBBY is kind of like being nosy, but in a nice way. So my mother would always say that Mrs. McCracken down the road was NEBBY, and she went to our church, and she would always say, oh, you know, so-and-so, I think they're getting dementia. They're having a lot of problems. And this is kind of asking you to be a little bit NEBBY, because there's a nice part of NEBBY. NEBBY is also noticing when there are people in the community who are having problems, but not so much gossiping about it, but carrying on that information to somebody who can fix it, who can do something about it. So as I mentioned, I work for United Way, and I work for the Alliance on Aging. The Alliance on Aging is an award-winning collective impact movement. So we were recently recognized by United Way Worldwide as being the #1 collective impact movement for healthy aging in the country. Yes. The United Way is Lehigh, Northampton County. Yep. So our collective impact movement advances United Way's healthy aging goal of keeping seniors safe in their home. And right now we have about 300 members. So if you notice on your tables, there's an informational flyer about, or pamphlet about the Alliance on Aging. You can join the Alliance and it's no cost at all. This is a free service to the community. All we're trying to do is to connect people and get people organized around what we're trying to do. So if you'd like to, my name's on there, or maybe it's Priscilla's, but you just drop us an email. We need to have your email address because it's really expensive for us to mail things to people. So we pretty much just do email blasts. But we do send a monthly email to let you know all the different meetings that the Alliance is doing. So we organize people around public policy issues related to seniors. We organize people who are around fall prevention, so we bring in the hospitals, the health bureaus, people who are doing fall prevention programs. We're working on a group around chronic disease prevention, specifically diabetes, but we also from time to time have trainings for activity directors. We brought in Kelly Carney, who was on stage earlier this morning, to do the Montessori-based dementia programming model with activity directors last year. But if you're part of the Alliance, you get those emails, and so you know all of the different things that we're offering every month. All of our conferences are free. All of our classes are free. And it's really just a way for everybody in the community to understand whatever makes sense to them, how we're trying to move the Lehigh Valley forward and help older adults. So that is, by the way, the one way that you can change the world is to become part of the Alliance. And so as we're talking about the Alliance, and I said the Alliance is a collective impact movement, how many people here know what collective impact is? Okay, so collective impact is a relatively new term. And I say that knowing that the Alliance was formed about 15 years ago, and we were a collective impact movement when we were formed, but they didn't name it anything until about 3 years ago. So a collective impact movement is really a way to, they used to call it partnering or collaborating, but sometimes when people were partnered, they were kind of stabbing each other in the back on the back end, or just forced together by their funders or something, but not really working together. And from the beginning, the Alliance was created by holding a series of conferences across the Lehigh Valley. We asked anybody who was an older adult, who cared for an older adult, who worked with older adults, or who was just interested in older adults to come to the conferences and look at the research of what was going on in the Lehigh Valley. And we called the conference Imagine Aging. So think about what aging could look like in the Lehigh Valley 15 years from now. Well, now we're 15 years from now. So we had a vision in the beginning to reduce nursing home, to reduce people who were in nursing homes, and make sure that people weren't being placed there prematurely. And so we really put an emphasis on aging in place, making sure that people were able to stay in the community if they wanted to stay in the community. And now we're kind of doing our next evolution, which is really making sure that people don't have problems taking care of themselves. So doing more like chronic disease prevention, more fall prevention, to make sure that people aren't having health problems to start with, so that then they can take care of themselves longer so that they don't need supportive services. So we're kind of working on the next layer down. But a collective impact movement has to have a common agenda. So it has to have population level research and a clear goal that the entire group says, yes, this is what we're trying to do. And we have, from the Alliance, like I said, we have about 300 members, but we have 20 people here who are on our steering committee. So raise your hand if you're on our steering committee. And these members of the steering committee help to guide what that agenda is, and then we tell everybody kind of what our goals are. We also do common progress measures. So whether you're funded by United Way or not funded by United Way, we share our tools that we use to measure success, and we share them with anybody who is interested in using them. And they can measure their own success, And then we also measure how we're doing at moving the population level goal. So sometimes there are programs that are extremely effective, but they're only serving 20 people. And we need to be serving 20,000 people. So even though the program is very effective, it's not a big enough scale to make any impact. And so then we talk about how do you scale that program up to meet the needs. Or it might be that the program is very effective, but it's in the wrong spot. So all of the seniors who need help are in the Slate Belt, but the programs are all in Allentown. So how do we get the programs to the places where the people who need the needs most are located? And then mutually reinforcing activities. And that basically means that we play nice in the sandbox. So we're not beating each other up, undermining each other, stealing each other's customers, that kind of stuff. So we figure out who is the best person to serve this client and make sure that that person gets there as easily as possible, and possibly cross-referring. You know, if somebody walks in the door of an agency and they don't belong there, but they belong to this, they should go to this other agency, how does that case manager effectively refer to the other case manager? And then communications. So that's this, having a conference like today, and also having our monthly meetings and different meetings that we have where we communicate with people who are part of the Alliance. What are we trying to do? What steps are we planning to take to get there? And then the last of all is a backbone organization, which is what United Way serves as. So that's somebody who really just keeps track of all the meetings, keeps track of how we're doing on our outcomes, and checks to make sure we're making success. So our plan is to keep seniors healthy at home. That's our goal. And as you can see, we have 4 other categories, one being institutionalized. So about 5,000 seniors in the Lehigh Valley right now are institutionalized, meaning that they're in assisted living or in a nursing home. That percentage, by the way, is about 5%. And when we started the Alliance, it was about 15%. So we've been working on reducing that percentage. We don't ever expect it to be 0 because there are some people who really need to be in a nursing home, but we want to make sure that people aren't there when they don't need to be there. And then the next group is dependent but at home. So these are people who have an ADL or IADL difficulty for the social workers. But these are people who aren't able to bathe themselves, dress themselves, do grocery shopping themselves, and they need someone else to help them. And then the next group would be at risk. So these are people who have chronic diabetes, who have fallen repeatedly. These are people that if they don't get a health intervention immediately, they're going to become dependent. And then healthy at home. So there's the 5%, 25%, 55%, and 15%. So the percentages might not look exactly correct because I did them by eyeball. But the need for gatekeepers, this gatekeeper program, is pretty immense because our research shows us that there are 98,000 seniors in the Lehigh Valley, Lehigh, Northampton County, who are over the age of 90, or who are over the age of 65. And of those, 25,000 of them cannot meet all their own basic daily needs. So they need help with bathing, dressing, grocery shopping, transportation. There's something that they can't do that they need to do to stay in their own home. And of those dependent seniors, 4,950 of them, according to a very complicated sampling process, we are told that that number is pretty close. 4,950 dependent seniors report that, 1, they can't take care of all of their own needs, and they're not receiving any support at all. So those are the seniors that are really falling through the cracks. You know, in the olden days, those might have been the seniors that somebody would have said, oh, my neighbor seems to be having a lot of issues. And the church group might gather around and take care of them. Or, you know, there might be a women's auxiliary group that would come in and bake dinners for so-and-so down the street. But because of the nature of the way we've become fragmented as a society, these seniors are falling through the cracks. And we are specifically looking for these 4,950 of them. And if you find one, let us know. Right. And so we are looking at the dependent seniors. And of those dependent seniors, we already know that some of them are receiving support. So roughly 15 to 20,000 are getting benefits from the government or through the Area Agency on Aging, which is county government, but they're receiving services already. So they might be receiving transportation from Lanta, they might be getting Lanta van, they might be using a grocery shopping service through Meals on Wheels, but they're already receiving support of some kind. And then we have another group that are receiving what I call stressed support. So they have a family caregiver who is driving them back and forth to their dialysis appointments a couple times a week, but that caregiver is stressed out and can't do any more and needs support and needs help. So yes, the person is getting what they need, but the caregiver isn't getting what they need. And then we have the scariest group, the 5,000 who are receiving no support at all. And those 5,000 will definitely go on to a nursing home or assisted living if they don't get support. So now I'm going to turn it over to Amy to tell you a little bit about Catholic Charities.
Does anybody at this point have any questions? Yes.
What happens if you call a, say, such and such person?
I'm going to explain all of that in detail. Yep. Yep. Anybody else? Yes?
Where are you located?
This is the United Way, the Greater Lehigh Valley, and I work for Catholic Charities. It's a partnership for the Gatekeeper program. Okay.
She wants to know your street address.
We're actually located in the Avago building. Oops. Where is that? I don't know how to explain where it is. Yeah, right by Coca-Cola Park. Yeah.
Used to be LSI, but
Yeah.
used to be Western Electric.
A bunch of other things, yeah, you're right. So Catholic Charities is the organization that the United Way, the Greater Lehigh Valley, has chosen to partner with for the Gatekeeper program. We have a similar mission where we seek to provide services to individuals in need of support and compassion and care. There's already a geriatric case management department there at Catholic Charities. Perhaps some of you know Heather Strom. She's the case manager, and she is out there working with people who are 55 and older who are in need of case management services. She works with them anywhere between 3 to 6 months, usually, to get needed services in place. But Catholic Charities does a lot of other services. Perhaps you're familiar with them. If not, they are located on Union Boulevard in Allentown, and they cover all of Lehigh, Northampton counties. They're also up in Carbon County as well. And they have an office in Berks. So aging is everyone's future, right? I don't think there is a person in this room who is not aging at this moment. At least I hope there isn't. So I like going out into the communities and into businesses and talking about aging with people, because oftentimes we think we work for senior services and, you know, we work with elderly people. And we often don't realize that we are connected. We could all be experiencing some level of disability or loss, similar to that which a person who is 65 or older can be experiencing, especially with the early onset of Alzheimer's diagnoses that are going on. People are being diagnosed at 35, at 50. So when I'm out in companies, I've had people actually express concern about their coworkers exhibiting some signs of dementia and what could be done. So this Gatekeeper program is actually raising the awareness in our community around what we think aging is and what it looks like, and looking at our own issues with addressing it. So the reasons why maybe those 5,000 people who report not getting services, why they're not getting services, right? there are several reasons. Most of the reasons might have to look like why we don't get help when we need help. Right? Except it only increases, it only intensifies when somebody is aging because there's a lot of fear. There could be denial. They are desperately holding on to their independence. They don't want to let go of control of their own life. They're scared, perhaps, that they might be having to move from the place where they lived their whole life. And nobody necessarily wants to move into a nursing home. So they're afraid if they just ask or share that they need some assistance, that might be seen as a sign of weakness, and subsequently then taken from their home and put into a facility. So many different reasons why people might not ask for care. Maybe they don't even know that they are in need of care, right? As dementia progresses, it's difficult to recognize, right? Sometimes, depending on how quickly it happens. So a lot of people, too, could be in denial even if they are aware. There's a lot of lack of information about services that seniors experience. It's hard for me, as a social worker working in senior services for 20 years, it's hard for me to recognize or to navigate, the system sometimes, let alone someone who is experiencing signs of dementia, or, the family is stressed and overwhelmed. They don't know who to turn to often. And of course, there's the stigma. They're afraid of having the diagnosis of dementia. They're afraid, as we've talked about, of putting it out there, of sharing. Isolation is a huge reason why people don't get connected to the services that they need to be connected to. I think the isolation actually transcends the geographic, the economic, and the social emotional, because that really affects all of these, right? They're not separate. Isolation affects a geographical location, whether somebody is living in rural Northampton County or they are downtown Allentown living in a high-rise. Someone with dementia or who is experiencing some type of disability may isolate. That might happen willingly or unwillingly. Also economic. There are a lot of seniors who are on a fixed income who may not be able to afford transportation. They might not know of the free transportation available to them. Or perhaps they can't pay for their medication, so they don't go to the doctor. They just stopped going to the doctor because the doctor's just going to prescribe them medicine that they can't pay for, and they can't pay the copays. And maybe they don't have anybody to help them get to and from the doctor, or they don't know that there's senior centers available that they could attend, where they could socialize with others, where they could get that emotional nurturing that they so need. So there's some general warning signs that we are training gatekeepers to recognize. What do we look for? These categories to be aware of. What are the red flags? A lot of this is intuitive, especially for social workers, especially for people who, in this room, you're all here because you are concerned. You're used to, you want to know. But take the UGI meter reader, for instance. This is not fresh on his mind, right? So when going to companies, we are, raising the awareness around, okay, perhaps we begin to look at the physical appearance with new eyes, the mental conditions, emotional state of somebody. Is there any physical loss or change that they're recognizing? And especially living conditions is a huge one. Now, for the utility workers, they might not necessarily see a lot of change going on. Maybe they're seeing somebody for the first time. But let's say the grocery store, okay? I included this for a reason, because my father has dementia, and it has progressed over time, slowly, and now more recently, a lot quicker. But he went to the giant grocery store, about an hour north of here. He lived by himself after my mother passed. And he would go to the giant grocery store almost every day of his life, pretty much. And so all the cashiers knew him, and he felt comfortable going there. And he'd walk in and they'd be like, "Oh, Jackie, hey, how's it going?" And he'd chat with them, and he'd come up, "Oh, how are you today?" etc. And it was his social outing. And it wasn't until after he came to live with me that we went back to that particular giant grocery store, and one of the cashiers pulled me aside and said, when your father was coming here by himself, he would just hand over his wallet to us and say, "Take what the bill is." And we recognized that this was not his norm. Why is he now giving us his wallet? Well, he obviously couldn't figure out how to manage his money anymore. And luckily, they knew him, he trusted them. There was a relationship there, which might not always be the case, right, in our society. However, in this case, that cashier could have been a gatekeeper, right? So, and that cashier noticed a change. So we're looking for those types of businesses where there's people who could recognize a change in somebody's behavior, in their physical appearance, in their mental, emotional state, and who could perhaps make the gatekeeper referral. I'm thinking that they are perhaps salons and barbershops, right? Where do we spend the most time? Going to the same person that we trust, we develop relationships with. What about garages? Car repair places. You trust your mechanic. Convenience stores. Some people go to the same convenience store or deli, on their block for years. Where are the relationships formed? Who might notice a change? So we're looking at, say, the physical appearance. Like I said, a lot of this is intuitive. You know when something is not right with somebody's physical appearance. Perhaps they're incontinent, say, on a regular basis, and they never used to be. Missing articles of clothing, obviously, if it's the middle of winter and they're outside in flip-flops and a pair of shorts, perhaps something's going on. And maybe they experienced some weight loss, which might indicate they're not eating, or maybe they're sick. A lot of times also, just a couple questions that can be asked might clarify the situation. Maybe somebody was trying to lose weight, or maybe they did experience an acute illness where they did lose some weight, but really they're all right. But if you're noticing bruises on a regular basis, that could indicate a fall, frequent falling, or it could indicate abuse. Perhaps a question to that person, if you have that relationship with them, could clarify that situation, and you could then be a gatekeeper making a very important phone call. The mental conditions, who might notice this, I use the example of, say, a food delivery person. Maybe a senior calls for pizza every Friday, and that delivery person shows up at the house, and the senior says, "Oh, Johnny, my nephew, I haven't seen you in so long." That's an indicator perhaps that there's something going on there. And that delivery person could be a gatekeeper. A neighbor or church member might notice increased forgetfulness. Somebody that they've known forever, now they don't know or recognize. Delusions. The seniors who are convinced that they're going to win the sweepstakes, or that they have won the sweepstakes, and they're expecting, $100 million in the mail tomorrow. And so they're going out and buying everything because they're expecting to win that sweepstakes. Maybe, but doubtful. Every instance I've seen that's unfortunately not been the case. There's a difference between, obviously, somebody forgetting where they put their keys and asking the same question over and over. Like I think somebody said earlier, the example of not knowing what a key is or why they need the key. Emotional states, again, difference between crying because somebody has lost a pet and not being able to stop crying because their spouse passed away 6 months ago and now they want to go home and play with their guns and, saying that there's nothing worth living for. That might indicate that that senior could be in need of some counseling or intervention. So listening for those types of things as well. We're talking with the business people. There's a great video that I believe Connecticut Gatekeeper program put out. And it shows a gentleman, an elderly gentleman, going into a liquor store buying like a gallon of whiskey every other day. And, he always has an excuse why he's there, 2 days later. I dropped it on my way home, or I had people over, or my dog spilled it. But that liquor store cashier guy recognizes that, he's also sad, and he's tearful. And then after a conversation, uncovers that his spouse did pass away and he's drinking himself to death out of depression. That cashier person is the gatekeeper in this instance. Where are we? Am I doing this? Are you doing this? And then there's physical losses and changes. Somebody has a stroke and they lose the ability of their, left side. That's going to change somebody's reality pretty drastically. If somebody loses eyesight, right? My mother had macular degeneration, and she did crossword puzzles. She crocheted, she knitted, she read constantly. When she lost the use of her eyes, she became severely depressed. We had to look for other ways to engage her and things that would, make her happy. So physical losses and changes definitely can increase depression and isolation. Pretty obvious. Economic and social conditions, family, living or moving far away from the senior. A lot of times we see family members coming in from out of town around the holidays, and they cannot believe, the condition that mom or dad is now living in just, a few 6 months later than the last time they've seen them. There could be the isolation, of just not being able to reach a neighbor, not having a social system around the senior. In which case we can connect them to a senior center, could get them transportation through, several of the services that exist. And the living conditions. So this is what the utility workers see. It's what the city workers see. Just to give you an idea, the cities of Allentown, Easton, and Bethlehem, all of their employees are trained gatekeepers as of 2 weeks from now. But the codes departments, the streets, the trash collectors, parks, the folks who take the bills, the cashiers, the utility workers, postal service we're working on. So anybody who's going out to the home, anybody who's going to come in contact with a living condition, they are now trained to recognize, say, strong odors, many pets, piled up newspapers, lights on in a house for days. That might indicate that there's a situation inside. Okay.
All right, so that's a little bit of the training that Amy does with all of the different companies that she's going out and working with. But a big part of what she also does is kind of work with the management of the company. And what we found is that a lot of the senior management in companies don't want to get involved. That they're worried that if their employee makes a referral that they might get sued, or the person, they might lose the person as a client. So a lot of what she does is talks through the confidentiality of these phone calls. And so for those of you that would be a actual gatekeeper, I believe we've passed out some gatekeeper cards. If not, there are some on the tables. And what you'll notice is that there's a number. When you call, and this is any time that you call these numbers, they go to the Area Agency on Aging. And so for those of you who are social workers, who are traditional referral sources, you probably are already calling the Area Agency on Aging to make referrals. But this number specifically has a gatekeeper number so that we can track who heard us through the trainings, and also which company they're tracking back to, so that we can go back to UGI and say, we did get 4 calls from your employees, but, oh, here's the card. Yep. And so everybody who got the training today will be under 10107. And it should be already written.
No, it's
Oh, it's not. Okay, so if you have a card, write 10107. And, yep.
Yep, that's your gatekeeper ID number.
And that way, nobody is being self-identified. I mean, the Area Agency on Aging, and John Mailer just walked in the back. He's the director of the Northampton County Area Agency on Aging. And he will attest that they absolutely do not tell people who called. And so they hold that information confidential, whether you're a social worker or a gatekeeper. But we do ask that people give their information when they call the gatekeeper line, just because sometimes the case managers have questions and they want to call back and make sure that they understood what you said, especially traditionally what the Area Agency on Aging has been doing is making a follow-up contact with the person. So they'll go to the person, they don't say somebody called and made a gatekeeper referral about you, or somebody said that, you know, there's awful smells coming from your house. They don't do that. They say somebody who cared about you thought that we should follow up with you because we have some services that might be able to help you. So they do it in a very non-threatening way, and of course all seniors fall under the guidelines that fall for all seniors across the country, that they can refuse services. So if they feel like they don't want services, they don't want to use a transportation service, they don't want somebody grocery shopping for them, they don't have to accept it. But we do ask that you call the Area Agency on Aging, because if it happens to be a more serious situation, they're able to take control of the situation. If there's like severe neglect or something going on, they have the ability to pass that on to protective services. But in general, what they'll be doing is offering senior centers, grocery shopping programs, transportation, Meals on Wheels, friendly visitors to come out, maybe homemaker health aides who will come and bathe people and do laundry, that kind of stuff. Yep. So when you call, you want to call the county AAA where the person lives. If you're outside Lehigh or Northampton County, you can call the AAA there. You would just look it up. State that you're a community gatekeeper and you'd like to make a referral, and be prepared to provide as much information as you can. And like I said, you call the AAA, you give them the information, and then they assign a case manager or make a phone call to follow up with the person. You'll never hear back about what happened with the person, because it's confidential, but you can always be assured that they follow up on every single phone call that they get. And so, I said in the beginning that there are 4 ways that you can change the world today in the Lehigh Valley. And number 1 is to join the United Way Alliance on Aging. The information's there, it's free. You can just write to us, get on our list, come to our meetings, see what we're doing. Number 2 is distribute the gatekeeper brochures. Like we said, we're trying to reach gas stations, CVS, little pharmacies, all these different places that come in contact with seniors. So if you know somebody, if your spouse works for a company, something like that, give them the brochure and suggest that they give Amy a call. And if you happen to be a person who is not already a social worker or a person who's a traditional referral source, then you are a trained gatekeeper, so keep the card. And if you see somebody through your work who's having an issue, you can feel free to call in. And then let others in your field know about the Alliance and the Gatekeeper program. We're really trying to reduce the marketing costs for all of these programs that are trying to reach these 5,000 seniors, going out to senior fairs, doing email blasts, trying to reach these seniors. If we can reach them as one collective group and get them involved in all the services, then it reduces the marketing costs for everybody and makes everything more efficient. So, yes. Yes. We are located in Lehigh, Northampton County. And for those of you that did not get our setup, I'd like to thank Michelle. So if you notice, she asked several times the exact same question. And so how many people at first were like, why does that jerk keep asking the same question? She already knows where they're located in Lehigh, Northampton County. And then sometimes people just say, okay, she's crazy, I'm just gonna let it go. And you walk out of the room and forget that there's somebody who is showing signs of having an issue. So what we're asking you to do is to keep your eyes open for Michelle. And when you see a Michelle, call the Area Agency on Aging and let them know that there's somebody that could use your help. Thanks.